welcome to Hypnotize Me, the podcast about hypnosis, transformation, and healing. This is Dr. Liz. I am happy to be here today. Tomorrow is a holiday in the U.S. It's Memorial Day, and we honor our veterans who have given their lives for our country. And I hope that no matter when you're listening to this, you can take a moment to pause and just do the same thing. And no matter what country you're in, I know people listen to this podcast all over the world. Hopefully that's a positive process for you. Just to pause for a moment and honor people who have given their lives for your country, wherever that may be. Today we're going to jump into hypnosis for headaches and migraines. This is a big, huge topic because so many people suffer from headaches and migraines. I actually used to have migraines in my 20s and 30s. But not that often, not like some of my friends. But now my daughter, who's 15, is starting to suffer from migraines and pretty severe headaches. And it's really hard to see, right? It's so painful for people. So let's pause here and talk a minute about suffering before we jump into the research. So is suffering... The pain takes over your whole being and your whole body. Let's say that my foot is hurting. That's a chronic problem that I actually have. And if I move into suffering with it, I will start to feel like my whole body is hurting, right? And then I'll start to catastrophize even. My whole life is awful. Like I can't do anything because my foot hurts and all this stuff, right? That's suffering. But if I say to myself, oh, it's just my foot that's hurting. It's not even my whole foot that's hurting. It's just this one part that's hurting. And let me see if I can map that pain. Let me see if I can just pause for a moment and find the edges of it and notice where there's more intensity and notice where there's less intensity and notice where it starts to fade. Like my toes feel completely fine and the top of my foot is fine and the rest of my leg is absolutely fine, then that helps me contain it and take off the suffering. And that is a technique I actually learned from Shenzhen Yang. I will put his name in the show notes because he has an amazing series called The Science of Enlightenment. And it's all about the science of meditation. Wonderful, wonderful. If you want to give that a listen sometime or read the book. He has both audio and in a book. My point in talking about this is that that's harder to do with headaches and migraines. It really is. Like, I get it. Like, when your head is hurting, it does seem to take over your entire body. It really does. So we're going to talk about some of the hypnosis techniques and what they do. And let's see if some of them actually teach people to localize that pain. So the study I'm talking today about is by Dr. Corey Don Hammond. He actually goes by Corey Hammond, and he is a major player in the field of hypnosis research and hypnosis scripts. He is the author of what everybody in the field calls the big red book, because it's this big, huge red book of like, okay, if you're treating this, then these are the ideas and suggestions. If you're treating this, and it's like everything you can think of. So he put together that index, but he writes this article called The Review of the Efficacy of Clinical Hypnosis with Headaches and Migraines. It was published in 2007 in the International Journal of Clinical and Experimental Hypnosis. And if you're a research geek like I am, I'll put the link to the whole article in the show notes. So let's see what it says. So this is a review study. Let's be clear about this. This wasn't the original research. But he went through and reviewed all these studies and said, like if I look at 20 different studies, what do they say about the efficacy, the success rate, basically, of hypnosis for headaches and migraines? So he did all the work for us, basically. That's what meta studies and reviews are. Like, I'm going to do the work for somebody so they don't have to go look at like 10 or 20 studies. So here we go. So he looked at the studies that he reviewed to see, did they all meet criteria for being a quote unquote good study? Okay, like was it a randomized controlled studies? Were there people that thought they were getting treatment but didn't actually get treatment? Were there people who were getting treatment? Like, all of these good criteria are established for research. So he went through and he said, yeah, actually, there's so many studies that were conducted really well that we can say that hypnosis is an efficacious and really rigorous treatment for migraines and headaches, meaning it works really well and it's scientifically based. Okay, so it's not just like 1 or 2 studies that said, yeah, we found this result. It is a multitude. So this first study he looked at, they followed people for a whole year. The treatment was 6 sessions every 10 to 14 days. So that's every week and a half to 2 weeks. And they taught them how to do self-hypnosis at home to manage their migraines. And they also asked them to rate, like, how many are you getting? How many are grade 4, meaning blinding and totally incapacitating? That's what they rated a grade 4. And then they compared these people to people who just got prescribed medication. That's it. So during the second 6 months of follow-up, the people who just had medication had an average of 2.9 migraines per month. Those that were taught the self-hypnosis technique had an average of 0.5 migraines per month. And then we jump ahead to 1 year follow-up. This is where it gets pretty amazing. So at 1 year follow-up, 43.5% had 0 migraines for the previous 3 months. 0. That's crazy, right? Like 0. Those that had just been prescribed medication, about 12.5% of them had 0 migraines. So this was a statistically significant difference here due to the size of the study. Okay, so that's a big, huge difference. You take medication, which people often don't like. It makes them feel certain ways. Or you can learn self-hypnosis. They did another study with kids aged 6 to 12. And this was a really complicated study in terms of how they time things and medication versus placebo versus hypnosis. But what they found is that at 1 year follow-up, the placebo group and the medication group had about the same number of migraines per child. So at the end of 1 year, it is around like 13 or 14. That's probably about 1 a month. Or sometimes what happens is they cluster. But in the hypnosis group, it was 5.8. So that's like a third. And that was statistically significant too. Okay, I can just hear myself as a mom being like, have you practiced your hypnosis? Have you practiced your hypnosis? Like being on my kids. Well, the medication is just as difficult. Some kids hate to take medication. So it's not like they're like, eh. And there's risk there, right? Like I would much rather have my daughters not take medication for something like this than take it, right? Like I think it would be easier to be on top of them for hypnosis. So he looked at another study where it was a group hypnosis. It was a 12-week program. And at the end, they found that the duration of migraines was significantly shorter. The frequency was significantly lower at the p.0001%. Okay. That's like unheard of. If you're into statistics, you'll see a 0.01 or a 0.001, but a 0.0001 is like, wow, it's really unheard of. And the severity of the migraine was significantly reduced. That was just a 0.0005. Still fantastic, right? I think it's so funny to see statistics like that, like really incredible. And medication usage was also reduced by almost 50%. So you're saving money right there, side effects and money. Migraine medications, the prescription ones, are often really expensive. So this is an added benefit. So that is amazing. I may run a group treatment myself. He looked at another study that was a 4-week treatment. And at the end of the 4 weeks, the hypnosis group was experiencing significant reduction in number of headache days, hours, and intensity. This was statistically significant. Not only that, they showed a significant reduction in their level of anxiety. I totally get this because believe me, if you think a migraine is on the horizon, your baseline of anxiety is higher generally. You're like, oh my God, not another one, right? Or it could happen at any time. Like you sometimes get into that type of thinking. So it also helped reduce that level of anxiety that people were experiencing. So those patients reported that it gave them a sense of control over the headaches. It helped them relax better. It changed their perception of the pain and prevented tension from building up during the day. Like that's some great feedback to get. It's like, yeah, let me do this study and see if I can control my headaches and migraines and change my whole life, right? That's how I see it. Like, yeah, your whole quality of life is going to be better. So he goes on, talks about other studies, but we're getting close to our end time here. And again, I'll put the link in the show notes so you can read all of those if you like. But basically, this is a treatment that has no side effects, improves other areas of your life, and is pretty cost effective compared to ongoing medication. So you're talking 4 sessions, 6 sessions, 12 sessions was the longest I heard. That's like 3 months of treatment, about maybe a little bit longer, depending on scheduling. And then your whole life gets to change. So that to me is wonderful. Absolutely wonderful. So I did say at the beginning that I was going to talk a little bit about what kind of techniques they're using. So I want to keep my promise to you around that. Not all the studies in the review listed what techniques they were using. I'm sure we could look up like the specific study, but some of them did. And basically they're using imagery techniques where they're changing the sensation of the headache. So you're using that. One study used the technique of having them transfer the pain of the headache to another part of the body that was less disabling. So let's say, I don't know, your elbow or something. Who knows, right? I'm sure everybody picks their own, but it's like, and then dissipating the pain. So let's move it from your head to somewhere else and then dissipate that pain. And most of the studies also used what we call in hypnosis, like future imagery. So imagining yourself in the future with less headaches, or a headache where the severity is less intense. You know, sometimes it's a step-by-step process. Like it's sometimes easier for someone to imagine themselves with a headache, but it's just like a mild headache. And then later they can have the ability to imagine themselves headache-free. Sometimes at the beginning, that's quite a large leap. Let me imagine myself migraine-free for someone who has chronic migraines, right? So it's a step-by-step process. So those are some of the techniques that are being used. So another technique I saw used was to visualize the arteries in the neck and head as being swollen and throbbing, and then to imagine them becoming smaller and more comfortable. Right? So changing that blood flow pattern. These are some pretty cool techniques that you can even try at home if you have a headache, or I mean, really, if you're having chronic migraines, I say go get treatment from a trained hypnotherapist, right? Because I bet you've tried all kinds of stuff, really. But if you want to try some of the visualization techniques at home and you feel a headache coming on, you can do this. You can imagine some of these things happening. You can imagine the back of your neck and where you start to feel that tension becoming softer, more pliable, cool and comfortable, those kinds of things, right? So I'm going to wrap up here. I hope you have a wonderful week, people. I absolutely love getting feedback, emails from you, questions. Please keep them coming. And I will talk to you soon. Peace. If you like this episode, do me a favor and rate, review, and subscribe on whatever player you like. Or even better, tell a friend so that more and more people learn about hypnosis and how it can be helpful for them. If you want to know more about me, head over to DrLiz-Hypnosis.com. That's DrLiz Hypnosis.com. You can see the downloads and see if there's one that's helpful for your life. Or you could also join the newsletter and get a couple of free files, as well as lots of good content. I've written a newsletter for well over 10 years. Go ahead and subscribe and join the rest of the world. All right, people, have a wonderful week.